My name's Dawn Fackler. I am a hospice nurse and a grief recovery coach. And Tim has agreed to have conversation with me today. Tim is a six-time best-selling author and spiritual counselor, specializing in stress management and relationship coaching. His unique approach offers disarming practical guidance, helping clients resolve long-standing issues and transform their outlook permanently. With a focus on real-world application of spiritual concepts, Tim empowers individuals to create lasting positive change in their lives. So, how did you get into this?
How did I get into this? Oh,
Yeah, how did you get into counseling in general?
the way most people do by mistake. Uh, my story, how I got into counseling, is I was always very interested in spirituality from a young age, and I actually I was going to like Zen retreats when I was very young. I lived at a Zen center in my early 20s, and so I always felt, because I guess you could say, the spiritual pull. Um, and I spoke to people about it some when I was in my 20s, but I never considered it as any kind of professional calling whatsoever. And continued to explore various spiritual teachers, self-improvement teachings in my 20s. And then my late 20s, I met my who was to become my wife, and she was a social worker. And it kind of, for the first time, I realized like I could connect some more therapeutic modalities and counseling, more traditional counseling perhaps, with the far out spiritual concepts I was into, and kind of intertwined the two with my specialty, which I would say would be like, or my focus, which is kind of like underappreciated mind body concepts and the relationship between our mind and body, basically. And yeah, I mean, I started doing it, as a very part-time thing. I was still doing real estate professionally. For like the first 5 or 6 years, I did counseling, was always very part-time. And then I eventually started writing books about some of these ideas and publishing some famous works that we might talk about today or not. Teachers like Neville Goddard and Emile Coué. And it developed into more counseling coaching as it went along. But that's been like a very slow, gradual 15-year process for me. But yeah, I specialize, I would say, in kind of intermingling really far out spiritual and mind body concepts with plain old common sense. That's my forte. So that's my journey, and I'll see all you guys later.
Okay, with that being said, the mind and the body, of course, today we're going to focus on grief. How would your technique differ from anyone else to help get through grief or even recognize grief? I know a lot of people don't even recognize a lot of times that they're grieving. Everybody
Right.
thinks it has to do with death, and it's not. It can do with losing a job or losing a partner, just a relationship dissipating.
That's what I deal with a lot, actually. Honestly, recently, last year, is I've been doing more relationship counseling and coaching, and it's amazing how many people experience legitimate grief from a relationship ending. But obviously, as you said, Don, there's grief is an emotion that we all feel, of course, when we lose a loved one, but in all aspects of our life. I don't really have a technique. I mean, I can tell you right now, the most far out, I just will use whatever works for a client. And I'm always trying to find new ways, new approaches, new modalities to make stuff work for people and for myself. The most far out thing I can share with you, if I have a technique that's out there for dealing with grief, and it's not necessarily what I would say is the best solution, quote unquote, for most people, but the most far out thing I can share is that your grief is all imagined. And by that I mean that right now, if we get present, like right now, right now, where's the grief? Don't think about it. Where's the grief? Where is it? Where is any emotional conscious response? There are feelings in the body, but where consciously is the story if you don't think about it right now? In my opinion, if we want to get real, which most people don't, quite frankly, but if you want to get real, there's no story. There's all these feelings that I think should process, and I love processing with clients. But if you want to get real, right now, where are we? We're right here. That's it. And there's nothing that's not right here, right now. If there's anything different about what I teach, it's that. Everything else is added upon that. But I really honestly always come back to that when I need to in my own life, and sometimes with clients. I mean, honestly, we can always pull the rug out from under ourselves. We can always point out that the emperor has no clothes on in reality. And that's what that is. That's thought, and realizing that without the story, the conscious awareness of a problem, there's no problem. There might just be pain. But putting something on top of that pain, honestly, is, if we're being honest with ourselves, not real. That's just one approach. That's a very shocking approach. And if you're not careful, it can very easily lack empathy. So
Yeah. I feel like fear and grief kind of go together too.
they're certainly cousins if they're not right next to each other. Yeah. Shame too, sometimes.
Yes.
What I generally with people, I have that as like that, what I just mentioned is always there as an option. But generally what I would tell people, what might be more helpful for people on the call or watching this later, how I deal with grief, generally speaking, and with any difficult emotion, and you've probably heard this before, this is not unique, but it's very effective for most of us. The technique or the trick is you feel it. You allow it to be there, and you don't judge yourself for it. You're gentle and loving of yourself, and you allow yourself to feel it.
And that's definitely what I try to teach my families with hospice.
For
I
sure.
hear so many times, I have to be strong. I have to be strong for so and so. I have to be strong for dad because mom's passing. I have to be strong for my kids. And I always have to ask why. Why do you have to be strong? And what are you teaching them? You want them to express and to work through it and to deal with it. You're not teaching that if you're being strong. You have to feel your own emotions if you want to teach your children or anyone else to feel their emotions as well. And it sucks.
Exactly. And
And
that's the practice.
uh-huh. And that's why every family, I said, I've done hospice for almost 4 years now, and the only word that I have found, there's nothing more professional, there's nothing more derogatory. It's just, it sucks.
Yep.
And there's nothing that's going to make it better or worse. It sucks, and you got to get through it.
Mm-hmm.
And
Yeah.
it kills me how everybody's so scared to talk about it.
Right. Well, that's, when I initially spoke to you, and I can just sense from you, like, that's the thing, is that people can sugarcoat it, or they can kind of tiptoe around it or dance around it and be on social media and give all this highfalutin language. But the work, the practice, dealing with grief, as well as these other very strong emotions, fear, shame, means becoming intimate with them and looking at them. And that is, it sucks is a good way of summating it. And it can be scary, it can be daunting, and it's some of the most rewarding and necessary work that most of us can do on ourselves and also for our loved ones. Because as you said, it's a great point. How are we supposed to show loved ones, especially, our children or younger people, how to act if we can't do it ourselves? It's just doesn't work like that.
And I feel like society teaches you to just shut it down.
For sure.
Suck it up, buttercup.
Yeah.
And keep on going.
Right.
And
For
that
sure.
it doesn't heal anybody.
Yeah. I mean, it's really interesting. Or at least I find it interesting. I think a lot of people find it interesting when we just start looking at the feelings that we've pushed down and repressed or suppressed or whatever you want to call it for our whole lives, at least our whole adult lives. Because yes, it's scary. Yes, losing a loved one, whether it's through death or through a relationship ending or some other kind of trauma, is yes, it sucks. But then we do have a choice of looking at it honestly within ourselves. And as you mentioned, most of the time, generally speaking, culturally, the idea is to distract, to move on to the next thing, to just kind of push it down. And pushing down does not, it can be an appropriate short-term tool, but what's not processed cannot be transcended. What's not looked at honestly can't be truly healed and transformed into something beneficial going forward. And the short answer, I think, that hopefully most people on this call can agree with, or that we can convince you to at least try, is the way to do that a lot of the time is simply to look and feel the feeling and have the courage, bravery, and openness to do that.
Don't be afraid to look at yourself.
Right.
And most of the time, that's who we run from.
Only always.
As I had, we had a lot of times there's a little book that explains, most hospice companies that I know use it, different type, but it basically explains the mental and the physical changes that start coming at you. And it even breaks it down to a timeline. So you can almost look at your loved one and think, oh, we have like 2 days and they're going to be gone. And it gives you the clinical side of things. And they always look at me when I say, you need to read this. And they're like, they just kind of look at me. I said, it sucks and it's hard and you don't want to. But I feel like if you know what's coming at you, it's a lot less scary than if you don't know. So it's like knowledge. And how are you going to ever acknowledge? You got to acknowledge what's going on with your life. I mean, knowledge of what you're dealing with and what you're going through is going to help you heal from it. But nobody wants to talk about it. Nobody wants to talk about funeral arrangements, pre-arrange things. They're like, oh, well, we'll deal with that later. And you realize nobody's getting out alive, right? That's kind of the end of the thing for all of us. Nobody gets out alive. So why tiptoe around it? Let's talk about it.
Yeah. Yeah, I think the irony is there is a wealth of good information out there to prepare, and there is a clinical side, and there's all this good psychological advice that's been documented and that you can talk to someone about preparing mentally, emotionally, logistically for passing, and dealing with it. And people don't want to look at it. And this comes back to, again, the main thing I think I want to convey on this call is just being okay sitting with the process and
Being
sitting with
sad.
your feelings, you
It's
know?
okay to be sad.
Yep. And
Sorry,
when,
I didn't mean to interrupt. That just came. I was like,
of
it is
course,
okay.
exactly.
It's
No, and
okay to be sad.
so, what I think what we mean by this is like, one thing you can do when you're experiencing grief or in the process of losing someone or having lost someone is you can allot yourself a time, I would say each day, perhaps multiple times each day. And if you can't do it each day, at least try to do it. Don't miss 2 days in a row. I like to say recently, like, consistently allot yourself a time where you sit and you allow yourself to just feel your feelings. And you don't think hard about what you're feeling. You don't pay attention to the thoughts or stories associated with the feeling as much as just feeling the feeling in your heart, in your chest, in your stomach, in your head, in your throat, wherever it comes up. That strong feeling is telling you something, is helping you process, is actually helping you heal. And often we project a story or worst case scenarios or all this made up stuff onto the feeling. The feeling does not want that. The feeling wants to actually be heard, generally speaking. And a simple way to hear it is simply to sit with it for 5 minutes, 10 minutes, maybe longer each day and feel it. And you can do that.
And I know I got off on the losing someone, but like even in my own personal life, I've had to, it's a transition. My daughter's 18. She's moved out. That life is now, I mean, I'm still her mother, but she's an adult now, and that part of my life is done, and I have to find new. There's something new for me to do because, and you grieve it. I grieve the fact that my daughter doesn't need me anymore, but you're proud too. Like there's so many cross emotions with everything that goes with stuff. It's never just one emotion, it's always several at the same time.
Mm-hmm.
Yeah, I'm having to learn how to grieve the difference in life.
Mm-hmm.
With Alzheimer's patients, I try to explain to families, you grieve twice. You lose them twice, mentally and then physically. I lost a job a year and a half ago, and that really, a lot of shame comes with that.
Mm-hmm.
So yeah, I'm like, it amazes me how much all the emotions intertwine with each other, but nobody knows exactly how to name what it is.
Yeah. Yeah. And um, there's a lot of things we can do with the emotions. Again, it's hard to even label what is what. And just feeling, as we've been going over, is obviously a very effective and straightforward way to do that. But there's all these ways to you just get to know them better. I speak to a lot of people, and I like doing internal family systems work, IFS. Richard Schwartz's modality, where people really get to get curious about their emotions or their parts. These aspects that they feel. So for instance, if you're feeling a feeling, if you're feeling, like tightness in your chest, right, and you feel sad or something, you can ask that feeling, what do you want? What do you want me to do? And very often, if you're being honest with yourself, it will answer you. It will tell you. It will tell you. And you actually can start to have a dialogue. And again, IFS goes into detail about ways of doing this. You can start to have a dialogue with this part, this feeling. And again, this is this is the same feeling we've been trying to, push in the closet and push down and not see or talk to or admit is there for years, often our whole adult life. Often that feeling in the pit of your stomach or your chest or in your heart area or in your throat, it's been there since you were a kid. It wants something. And when you look at it as opposed to pushing it down, it will communicate with you differently. And again, you can do this. A skilled, counselor, coach, therapist can obviously help you do this, but you don't necessarily need anyone to facilitate it, because you can facilitate it for yourself. And something to remember is when you do this type of, exercise, you, the big Tim, the big Don, is in charge. And you're calm. You're going into this not being so reactive to this feeling, being as angry or scared of this feeling, but just curious and open as to what big Tim is experiencing right now. Oh, I feel this in my chest. And I feel it. Maybe I just spend a couple minutes feeling it. And then I can ask it a question like, what do you want? How can I better serve you? How can big Tim better serve you? How long have you been here for? It will start answering you probably. It's okay if it doesn't. But these feelings want to talk.
They just want to be heard and acknowledged, just like we do.
Exactly.
Does anybody have any questions or comments?
This is Linda. I mean, this is great. I think what I've heard is, for me, dealing with feelings has been just been my work for years. And just, you don't hear it nowhere else. And so for me, sitting here and hearing it, it's like, yes, someone gets it. And often, because it's not really taught and everybody's running away from grief. I'm a nurse, as Dawn knows as well. I did a little bit of work with those who were terminally ill. And I established way in my mid-20s just a belief, as I was talking to my patients at that time and family. But now I'm older adult, right? My gray hair, and you're watching people pass away. I lost my husband 4 years ago, and how I went through that whole process dealt with feeling. And so many people kept on telling me how I should have been feeling. And I just like, what? And I had to step away and close up and just push them away, because I had a true understanding to how I was feeling. So for me, I want to say thank you. I like, Tim, you described the big Tim. I call myself this, the little Linda, big Linda. And how you related that back and forth. It's like, wow, using it now, or, at times just when the thoughts come up or the feelings come up, to really go back and talk to Linda, little Linda, and let her know that big Linda has it under control still. You can still stay at rest. I don't need you to take over, because often the taking over is those emotions that gets out of control. And then, you stay out of control for a while. So I just wanted to say thank you, because this is a space that I can relate to, and I feel like I've been heard inside myself. So thank you.
Thank you, Linda. Yeah. It's so important to feel these feelings, of course, and to acknowledge them. That goes without saying. It goes without saying here, not in most circles. But it is also, I think, vital to emphasize. And I've been thinking about this a lot recently, is that, big Linda's in charge. in a great way. Big Linda's mature, has lived their life, made it this far, and is very, very capable, and is basically parenting little Linda. It is providing that support and that love. When we do this feeling work, why it can sometimes backfire. And honestly, if we're doing it the way we describe and just feel honestly and with love, I don't think it can backfire. But why it can kind of go off the rails sometimes is that people feel their feelings too much, but don't allow that the big Tim, the big Linda, the big Don to parent and to love. So they get swept away by the feelings and into the story too much. And as we have been speaking about, this is about creating a safe space to feel the feeling, but at the same time, you don't want to let the feeling kind of run the ship, because it doesn't know how to run the ship. It needs Big Tim. It needs Big Linda. It needs Big Don to run the ship for it, to guide it, right? Before, so often we were trying to lock it away, not hear it. A kid that we don't want to feed or nurture or listen to. Now we still are the parent. We still are in charge, you could say, but it's in a loving parent-child way. And we could use other language. We don't have to use that metaphor. But the point is, the big us that calm us, the person that knows I'm here right now, things are okay right now, is also the same person that's capable of loving this feeling and not judging it harshly and actually listening to it. So without that reference, we can still get overwhelmed with the feeling. We can start feeling the feeling and get lost in the feeling and feel, at least short term, even maybe quote unquote worse than before, because we haven't been able to keep that balanced and more objective tone. So that's that's the interplay that just comes with experience and practicing this for yourself in a place that feels safe and secure for you. I hope that made some sense.
That did. I want to say thank you. I think what tends to happen when you have a lot of folks who don't understand, I had spent the time trying to justify, and there's no justification, to how I feel. Just feel, like I would say, just feel it and it's okay. But I like the fact that you describe it, that still being able to parent. The word parent was a good word, by the way. Thank you. To be able to parent and still be able to look at little Linda, or that the emotion that's taking place. And in life is more than just a loss. Because if you're a caregiver, there's many different losses. Like I have a mom who has dementia. So it's happening. Dawn, you just described many times through our lives, it's occurring, and often it's dual. It's not often just one thing. It tends to be many things going on at one time. And that's the balancing act, that as we learn our emotions and our feelings, it'll help us to go much further than where we are even right now. So thank you.
Exactly. Thank you. Great points.
Anyone else have any questions or comments?
I can keep talking for a long time. So what usually happens is people at the end, everybody starts getting chatty at the end. You know what I mean? after we're done is when people start talking or whatever. But yeah, there's plenty more I can talk about. So
I'm with you. I can talk all day long. So
this is what we do, right?
Yeah. I'm good at this.
Oh gosh. Yeah, if anybody has any other questions, obviously they can type them in or go on video with us. Yeah, I would just like to say that I think having support in the form of a therapist or a counselor or a coach or someone in person is very, very helpful. Okay, I strongly recommend that. Because it is a little bit different, or even like a group like this, for instance, like having some kind of support where you get to speak to an actual person is different than reading about it in a book or watching a YouTube video about it or what have you. Not to say the latter doesn't have a lot of power, but we get on calls like this and we realize that most of us are going through similar experiences in so many ways, and that we have many more commonalities than we do differences, especially emotionally. And so that's why, again, there's a lot of power in just kind of talking about this stuff that people don't want to speak about. And yeah, I honestly, I would not say I'm an overly optimistic person, and I've been heartened to see, I do feel like more people are discussing leaning into their feelings more, maybe in the last 5 to 10 years. There seems to be much more like somatic led, feeling led type of therapy and counseling going on. I know in the more alternative woo-woo space, which, you know, I'm part of, it's, you know, quote unquote shadow work has really caught on, which is basically the same thing when it's done with emotional honesty, you know, if you're coming at it from the right place. So I think that's a great development, because, you know, people still view therapy as like, oh, we're just going to talk. We're just going to talk it out. And that has its place, obviously. But if there's not emotional, if it's not emotionally led, where we're processing emotions while we are talking and we are just talking for the sake of talking, it often has limited lasting effects, you know? So yeah, wanted to share that.
So yeah, we do have a question in the chat. It says, when looking within to find what emotion or emotions may need to be processed, would it be easier or better to ask yes or no questions rather than open-ended questions, or might depend on the person? Personally, I feel like open-ended questions, because if you're just asking yes or no, they're not exactly getting into the feeling. It's just more, nope, don't feel that. Yes, I hurt. No, I don't hurt. Okay, well, why? Why do you hurt? What are you hurting about? Where is your pain coming from? Or grief or fear or whatever happens to be happening. Now, that's just my personal, I don't know, Tim, you may have a different.
No, I mean, I would definitely, I agree with that for sure, Don. You know, there's obviously exceptions. This is when we're talking about emotion and emotional work. There's no one set rule, obviously, but I think, you know, what we're getting at is you want to give your feelings, your emotions, the space and safety they need to communicate with you. And sometimes perhaps all they will be willing to do is answer yes and no questions, right? I mean, that might be the exception to what we're talking about. And if that's all you can get them to answer is yes or no, that's okay. But you want them to be comfortable to share with you whatever they want. And sometimes, honestly, for stuff that we've kind of repressed for so long and that we're like almost numb to, like grief, for instance, in my experiences, you'll just have to sit with it and just sit with it and be really patient. And maybe you say, like, what do you want? And you don't get a response right away. And don't get me wrong, I find you will often get fast responses from your feelings when you tap in, but there's going to be times where you're just sitting there and you're just with the feeling. And, you know, I want to mention, you know, one of my favorite books about this called Letting Go by David Hawkins. Pretty controversial book because he says a lot of stuff that a lot of people wouldn't agree with, and he says a lot of stuff that almost everybody would agree with, you know. So it's a mixed bag, you could say. But anyway, I think it's a masterful book. Chapter 2 of Letting Go, it's called The Mechanism of Letting Go, I believe is the name of that chapter. Wonderful chapter. I really recommend people read that chapter. But he says something very interesting where he says when he feels into feelings, he doesn't even label the feeling. He doesn't say, oh, this is grief, this is sadness, this is what have he says you can get, and again, this is just an option. You don't have to do it this way, but it's an interesting perspective. He literally says you can just feel you kind of feel where it is in the body, your head, your throat area, wherever it may be, chest, stomach, wherever, and just feel it. And don't label it. Don't be like, oh, this is shame, this is grief. Allow the feeling to be there without any preconceived notion of what it is. And then once you've done that, and he says, by the way, that's all you have to do. He says that's the whole process, is just feel. Because if you feel a feeling in that way, it will shift, and often much faster than you think. I mean, it is amazing. You can feel incredible stress when you wake up, for instance, or like, sometimes I have a nightmare and I feel incredible stress. And I've learned, I've practiced this long enough where you literally feel the feeling without judgment, and the terror that you think, oh, this is going to be with me all day, it's gone in 5 minutes. But then there are other times for deeply seated stuff where you have to feel it for a long time for that shift to happen. And sometimes you sit for 20 minutes with it and it's still there. And then you come back to it maybe the next day or what have you. But if we're patient enough, my point being, we're patient enough, we get answers. It might happen in 5 minutes. It might not happen until 5 days later, you're in the shower and you've been, sitting with the feeling for every day for a little bit of time. And all of a sudden you have a realization, right? And why I personally like asking open-ended questions, general questions, like, what do you want? How can I support you? Is because if we do that gently and don't pry, eventually these feelings usually tell us. But it's not on our set time. It's not like, oh, you're going to tell me within 10 minutes. I mean, you can do that. You can be coercive. But generally speaking, I would not be. I would be more open and loving. And I also want to say, I'm just going on a spiel here. I also want to say,
It's okay.
you can, and there are times I find it very appropriate. And when I work with clients, I often do this, where a feeling is almost standoffish. It's like we go in and there's this tight constriction around the heart or whatever. And it's like, well, what do you want? And it says like, I want you to leave me alone. Or like, like I'm here to hurt you. And like, as the parent, that's not true. And it's okay in those situations sometimes to be like, I know that's not true. It's like a parent who has to be stern with a child. Like, I want you to listen to me, know I love you, and I need you to tell me the truth. You can be firm with these feelings sometimes too. There's as much flexibility as we want. If we go in with an open heart and are like a loving parent, I mean, a loving parent is not always going to be like, oh yeah, sure, truck your muddy shoes into the house and then eat all the food and don't clean up. They're going to be stern sometimes. And sometimes I think that's how we should work with these feelings, quite honestly. Again, we don't have to, but I know for me, sometimes I have to be stern. I've surprised some of my clients by saying, you can kind of not yell at the part, but be very, firm with this part and see what happens. And what often does is then the feeling kind of, it realizes, oh, wow, I'm not running the ship here. They really are going to make sure that I sit down and give an answer, or at least am listening to Big Tim. So it's very workable. But the work comes from space usually. What's that saying? Like, the best way to control a cow is to give it a whole field.
You talking about just sitting with it? To me, I picture awkward silence. Awkward silence is okay.
Great point.
You don't have to fill the space with words. Just be there in the awkwardness.
That's huge. I mean, that's like, practically speaking, on the ground. That's so true. Yeah.
You're very welcome, Viz. So what books do you have out there?
My books, I've got a lot of books out there. The book that probably deals with this the most is, I have a very short book. It's called The Joy of Not Thinking. And it talks a lot about dealing with our thoughts and our feelings. And I go into some detail about some of the concepts we were talking about in there. I've got another book that people might like. Is a book called Relax More, Try Less. I wrote that about a famous New Thought teacher from last century called Neville Goddard. But the idea of, instead of working hard to solve things, especially emotional issues, relaxing into our feelings, relaxing into the moment, trying less hard to solve something that's not resolvable. Again, by like hiding the emotion in the closet is not going to resolve the issue. It's still there, you know? So Relax More, Try Less is a book that people might like. And then I've got a very active, I have a podcast called Law of Attraction Explored, and a YouTube channel that explores a lot of, more woo-woo concepts, very soberly. I am a big fan of connecting what we are talking about, emotional intimacy, getting to know our emotional landscape, doing that inner work, linking that with more, I guess you could say, fantastical ideas that like the law of attraction talks about. Because in my experiences and opinion, a lot of those ideas can be helpful if applied practically. Another teacher I'll mention, my favorite law of attraction type of teacher, his name's Emile Coué, who was a great, basically psychologist. He was just a pharmacist, but today he'd be called a psychologist. Considered really one of the founding fathers of the placebo effect. But he's a great example of somebody who really explains well how our imagination is running the ship, and why when we're dealing with our feelings, it's not willpower that is going to resolve our emotional issues, it's our imagination. And when we're sitting with our feelings the way we're describing, in my opinion, it's an imaginal exercise in the best sense, where we are changing how we feel about something through our imagination. And that can positively affect our life in so many ways. So I have a book of his teachings I edited several years ago called Simple Self-Healing, which deals with a little bit of what we're discussing today. But yeah, The Joy of Not Thinking is definitely the book of mine that deals with this kind of mind-body relationship in the most detail.
Now, can we find those on Amazon or?
Yeah, that little bookstore next door called Amazon. Anywhere books are sold. Yeah, for sure. Yeah, but I've never written a book just about this stuff. I think there's a lot of great books out there, honestly. And again, I suggest people check out modalities that are becoming very popular, like internal family systems, IFS, because it's all about working with your quote unquote parts. That's how Richard Schwartz labels it. And he says, like, his whole thing is there are no bad parts, there are no bad emotions. And 20 years ago, this was considered like, you have to be way out there to be talking about this, and now it's more mainstream, which is great.
It's almost like it was taboo.
Definitely taboo.
Mm-hmm.
Definitely taboo. And listen, when I say more mainstream, it's still taboo. And I think too, I mean, it's like, my therapist, she says, like, and I've spoken to other therapists, and I don't know, I think it might be a little bit more progressive over in the UK in terms of some of this stuff. And they're saying stuff like IFS is just becoming too popular, in the sense of where people are missing the point, because at its core, like, it's what we're talking about. And a lot of it sucks. Like it's never going to be popular in a way, in the sense of like when you're doing the inner work, like you have to, you have to go through the garbage dump to get the gold or whatever the saying is, you know what I mean, to get to the other side. So it's like, it's embracing that. And like, you can put lipstick on a pig, right? But it's still a pig. Like it's that kind of thing.
Mhm.
But it doesn't, I do also want to say it doesn't all have to suck. Like, it's like, I will say, sitting next to someone who's dying is not the way people think sitting next to someone who's dying is going to be at all. And that's a huge point that doesn't just go for that experience, but goes for so many life experiences. What scares us and shames us is the thought of what it's like, not the actual occurrence of it happening a lot of the time.
I've tried to explain to people because I have been there when they took their last breath, and just there's a peaceful, serene feeling that comes over the room that you just can't explain unless you've been there.
Mhm.
David would like to ask a question. Go ahead.
Hello. Thanks, Dawn. And thanks, Tim, for doing this event. So, first thing, I just want to say, found it quite interesting, even quite early in the call. I was thinking about what you were saying when you were kind of opening up, and I started to notice strong emotions coming up for no reason my conscious mind could really explain. I saw the letting go email and I signed up for it. I follow you, Tim, and have gotten a lot of value. You're brilliant out of your videos. Learned a lot from you. So I didn't really look at the small print, and I didn't realize it was about grief. And when I turned up today, I realized that's actually really relevant to me, even though it wasn't something I was aware of when I signed up. So anyway, thank you. And the question is really for you, Tim, what you were talking about with regard to David Hawkins and so on. I've been interested in his work, and I came to it from the Sedona method, Hale Dwoskin's version of it. And so I'll give you a quick rundown of my experience. I do the thing for lengthy periods, and the feelings just keep getting more intense, and they don't seem to loosen up. And I mean, so one of your videos a couple of years ago was very helpful, where you pointed out that people are, they kind of, it's different for everybody, but some people kind of might be exaggerating essentially, or or some people are just really good at letting go. They can let go like that. But when you said that you often have to sit with an emotion for 15, 20, 30 minutes longer before it even starts to loosen, that kind of, gave me some encouragement. I kept with as I understand it, with David Hawkins, you just sit. And yeah, don't label, don't think about it, or don't get involved in the thoughts when you're sitting with it. And like I said, the feelings keep kind of getting more intense, but having done it for quite some time and not really noticed much loosening or releasing, it's become quite frustrating. I've gone back to different forms of meditation. And I've wondered why was it so potent for David Hawkins when he took it up? Was it because he was already like a serious meditator, 2 hours a day, that he was like, way he describes it, it's like everything changed
Right.
quite rapidly for him. And he could just, okay, it was hard work. Like, he could do, 11 days, in a cabin in the woods, just feeling emotions before it would really release. But he was noticing major changes from quite early on. When I assume he learned it from Lester Levinson. I think I read that
Yeah.
somewhere, that he and I'm like Lester too. So I suppose the question is pretty obvious. Do you have any
Yeah.
any
Great question.
tips
I
Yeah.
hope, Don, I hope we didn't hijack this seminar with that. Thank you, David. Thank you for the kind words. And that's a great question. Very important question. And we can, we can do if you have follow-up questions to what I'm going to say, for sure.
Thank you.
I've got a lot to say. You can also email me after if we have to follow up,
Sure.
info@radicalcounselor.com. This is relevant for everybody. So I even though we're kind of in the weeds, getting very fringe with the people we're talking about, not fringe, but
Well, I think it is very relevant for grief as well.
it's absolutely. So this
Yeah.
is, what I would say, I'm just going to go and see what happens. But first I want to ask you a question, actually. Have you tried something like IFS where you ask I think that would be the first thing I would suggest is I think you might have more of a breakthrough or insight if you start asking the feeling questions. And I think, you could find an IFS therapist, you could work with me, you could just, there's a lot of videos on YouTube of Richard Schwartz it's really cool doing it with people. So a lot of your experiences I've experienced too, as you kind of alluded to, where Hawkins makes it seem like just you feel the feeling and that's it. Your problems in life are going to be solved, basically. And I don't agree with that. I think it might have worked for him. I also, he's got I love him, but as I said, he's a very controversial teacher and has a lot of kind of a checkered past. If you read his biography, you get even more details about how checkered it was in some ways in terms of the stuff he claimed, which is what's tricky about so many of these more alternative modalities is you don't know. And I honestly regard the Sedona method the same way. Like, you don't know how much is true and how much is valid and how much is just kind of like bunk and the particular teacher's kind of, dogmatic take on something that's you can't be really dogmatic about. But I've experienced that a lot too, where I sit with a feeling and it doesn't seem to shake easily. And I found IFS to be much more helpful. That said, in terms of getting, if a feeling won't move, to ask it questions and to kind of imaginally work with it. This is the thing, we're going to go full circle with the beginning of this conversation. So the other night, I sat with a feeling for about an hour and a half. It actually for me, usually when I have, because I've had an interesting last week. I've actually had two people I'm close to, two relatives die within the last couple months. So this is a very relevant conversation for me too. But I was working with a feeling in my chest. And this is like deep rooted stuff, like the fear or the issue of safety. Like that's like since I was a kid, like for sure. You know what I'm saying? And I was really, for whatever reason, very, I was in a good space just to feel it and gently be like, what do you want every couple minutes, but basically just feel it. And nothing happened. I mean, there was a gradual easing, I guess you could say, but not like a clearing or whatever after like an hour and a half. And again, I'm just like you, I'm just using all these tools and what I know, right? And so like it was the next day or the day after that. I think late the next day, I was thinking about the feeling. And I always come back to what I said again at the beginning of this talk. What's happening in the moment? I mean, if you see my stop being serious stuff, the joy of not thinking type stuff, getting movement involved. And I'm like, the truth of the matter, if I'm being honest, is this feeling in the chest, this reaction I'm having towards it, it's all imaginal. I made it up. The feeling is real when I'm experiencing it, but the interpretation, that loadedness, it's like a hallucination. It's not real. It's not real. It's made up ultimately. It's right now, is it like, so it's very interesting. You can go into a feeling like this, and then if you do something like don't think, basically, right? Where is it?
Mm.
Maybe there's a lingering feeling, but the story
Mm.
behind it, all that stuff, it's all of a sudden it's gone. Where'd it go?
Mm.
So
Okay.
these are things to explore, because it's a lot of our pain. It's these stories we've been looping since we were kids, probably. And I think it's really good to feel into them. And when something like is immovable, immovable, I can't even say it, you're unable to move it.
Yeah.
What's very interesting is you can do something drastic, and that's when you might get the insight.
Okay.
Think totally out of the box. So if the feeling doesn't move and it's really bothering you, totally change it up, perhaps. And also explore IFS and explore the feeling more. What I've found is like feelings like this thing in my chest, this idea of safety that sometimes comes up. It's very, very potent, and it's shaping my life in some significant way. But it's not like Hawkins says, where you just feel it and it goes away quickly, or it's just going to go away one day for good. Maybe one day it will just disappear. But I've gotten to know it and become basically friendly with it. Even though I say it's bullshit, like it's I don't feel that way. Like I don't want it. I used to want to just get rid of it. And now I'm very comfortable with it being there. That's the difference.
Okay.
That's the
Yeah.
that's the teaching and the nuance, if that makes sense. Does that make some sense?
That's very helpful, Tim. Thank you very much. And thanks. Hopefully that wasn't too off topic, Dawn, or everyone else here. But thanks for that very helpful answer, Tim.
Great question. I might have, and just email me any follow-ups you have about it. And yeah, I might have to make another video about that, because I don't like it. Feelings are feelings. And a book I want to mention, someone you've probably heard me talk about him before on the YouTube channel, David, is Robert Augustus Masters. He has a book called Emotional Intimacy, and he is much more about the feeling is going to be there as long as it's there, and your job is just to be with it and be okay. You know what I mean? That doesn't mean you paralyze your life, but the point is you're not like, oh, why isn't this shifting in 20 minutes? I mean, I think that somebody like Masters, because of some of the experiences he had, would say that's absolutely absurd.
Yeah.
It's going to be there, and I'm going to embrace it for as long as I need to. And what I guess you say, what I'm saying, maybe my unique angle, what Don was asking at the beginning, is I'm saying ultimately a lot of that feeling, it is imaginal. Like don't think right now. And it's like, in which case, like it's that, but just because it's imaginal doesn't mean it's like, oh, it's gone for good. It's more like if I choose to, I can notice it's like a projection, right? So yeah, Don, we're wicked in the weeds, but I think it was relevant, David, what we were talking about.
It was.
Yeah. And thanks for that, Tim. Yeah.
Thank you. Great question. Yes. Yeah.
Like I said, I mean, grief and all other, they're all intertwined. You don't have one without something else to go with it.
Yes.
I actually had a friend say everybody needs to watch the Pixar movie Inside Out,
right,
where it has the little emotions.
All the parts. Exactly.
Yeah, it has all the parts, and you figure out how like sad and happy can go together. And so no, I think that was a great question.
Apparently the sequel, I haven't watched it yet, has anxiety, and my wife and I are deciding whether we should let our soon to be 7-year-old watch it or not. I'm like, I don't know. Maybe wait,
I want to see the sequel. I haven't yet, and I'm like, okay, so whose kid can I like say, hey, let's go watch a movie?
Right, exactly. Yeah, no, it's great.
So
I think
it
it's
looks
great.
just like the adult going to watch a Disney.
It's so good for kids, though, again, to be able to emote, and like for you as the parent or the grandparent or the aunt or uncle or whoever, to be like, it's okay for you to express your feelings, and I remember when my Yeah, my older daughter was like, 4 or 5, like she would just cry sometimes. And at first, my wife and I were like, what, why, or like, what, and then we realized like, you just let her cry, let her process by crying. Um,
And it's like you said, there are times where shoving it down, you do have to do that because physical needs come before,
right.
you got that hierarchy. And if your physical needs aren't being met because of your emotions, you really need to shove those emotions down until you get food in your belly.
Yep. If
But
you're at work, you can't just be weeping all the time, like,
Yeah.
and expect everybody to be like, oh, they're processing. I mean, that's the thing, is we have this kind of soft, like, word where it's like, oh, that might actually work now. But the truth is you can't, that's not appropriate either. You know what I'm saying? Like, you have to do what you need to do, generally speaking, right? Understand that everybody's different and you have, but I think that the idea is to find time to reflect and to meditate, or whatever language, whatever word you want to use, because I know reflection and meditate are kind of loaded words, but just be with your feelings,
do what works for you, whether it's journal or listen to music or, like you said, meditate, reflect. Everybody has something different that works.
Mhm. Yeah. And I do want to say too, back to doing something shocking that with your body, I have found personally, and just working with many people over the years, that's how I got into counseling. Is like, is doing something playful, like jumping on a trampoline, singing a song, moving your body all about like wildly. It's really interesting when we do something vigorous like that, and it basically takes 100% of our attention to do it, and it's kind of absurd or what have you. It shifts something quickly, because we realize the feeling is not necessarily based upon what
Your
we thought it was. Yes, it's just exactly. It's more of an internal thing, right? So that, yeah, is definitely a go-to that people can utilize. Be playful. I have a video series from years ago. It's online, called Stop Being Serious. Stopbeingserious.com. I think that if not, I can send you a link to all the videos. But that really is a trick. And likewise, like blasting music in your car, singing along to it, talking in the mirror, making funny faces, like stuff like that. These are all ways to kind of take us out of our comfort zone in our normal way of feeling and thinking, which we then can go back to our normal way and look at the emotion or our thought pattern with a little more lightheartedness, a little less seriousness, which when you're grieving or going through heavy, emotional stuff, is incredibly helpful.
I like to color.
It's a great one.
I listen to music or listen to audiobooks and I color. When you said the vigorously, it made me think of Grey's Anatomy, where Meredith and Christina dance it out.
True. It's become a cliche, but it's because it works.
Mm-hmm.
And the thing is, we just don't do it all. Like a lot of times, like we do it once. It's funny. Like there's obvious stuff like that like works, and it's so silly or whatever that like we are just too obvious that we don't do it. And it's like, oh, let me do this complicated thing instead. It's like, no.
It goes back to what would people think of me if they saw me do this?
Exactly.
Well, who gives a shit?
Yeah, and honestly, just go do it where you aren't going to be seen. And something else I want to mention, I talk about the joy of not thinking. Speaking out loud to yourself and it is hugely helpful. And these days with people on their phones and Bluetooth, you can walk down the street having a conversation to yourself and people are just going to assume you're speaking to somebody, guys. So you can always utilize something like that even in public now. Because I always say talking out loud, often it's like your inner critic is that soft inner voice, right? But if you speak out loud, it's like the angel on the other shoulder, so that you got the devil on one shoulder, that's the inner critic, and then your angel is the out loud voice. You can often calm yourself down or sober yourself up or give a stern talking to, or do something to feel more neutral if you start speaking out loud. Another really rather obvious underutilized tool. So
I talk to myself because I need expert opinions.
there you go. True. Absolutely. That's Big Dawn talking to herself. That's Big Tim. You know what I mean? Because that's often the case. Another example of like the inner critic, like it's this childish part that doesn't know better, but Big Tim, when Tim speaks to it, can straighten it out or calm it down or love it, give it what it needs. So yeah, I love that. That's always been one of my go-tos, is speaking out loud.
Well, we have went over an hour now, so I have took up a lot of your time.
My pleasure. I love this. This is good stuff. Thank you, Don, for having me.
Maybe we can do it again.
Absolutely. And I'm
'Cause I'm
encouraging
sure
you, if
there-
you haven't already, to start your YouTube channel. Get more people talking the truth about this stuff.
And I've been looking into that. Last week I was down with strep throat. So, and strep throat as an adult is nothing like strep throat as a kid. So I'm a little behind on things I want to get done, but yeah, I'm seeing the value in it. I have listened to a few of your videos and I'm like, oh, okay, that makes sense.
Try to make sense at least some of the time, you know.
Yes.
But yeah, thank you again for having me on, and I hope that everybody got something good out of this.
Yes. Thank you. And we'll do it again. And thank you everybody for coming.
Awesome.
Great.
Have a good day, everybody. Thank
Bye.
you. Bye.